Welcome to Gillette. I'm Dr. Elizabeth Weber, one of the pediatric orthopedic surgeons here. I want to assure you that everything at Gillette has been designed for your child's safety and comfort and best experience possible.
Hi, my name is Ling. I'm here at Gillette today to have surgery. Surgery can help fix your body when something isn't working right. That's my dad. He's at the registration desk filling out my paperwork. When he's done, we head to an area where I can play video games or play on the computer. Before I know it, Nick, my nursing assistant, comes to call my name. On the way to my bed, I get to see some pretty cool art on the walls. Nick checks my weight, shows me to my bed, and checks my vital signs. My bed has a special blanket I get to keep. The bed has a sign with my name and my doctor's name too. My nurse comes to talk to me and my dad. She puts on an armband with my name on it and asks my dad some questions that will help me get ready for surgery. My nurse will also ask me when I last had something to eat or drink. It's very important for my stomach to be empty before surgery. Next, Carla from Child Life stops by. She talks to me and my dad about how I am going to fall asleep for surgery. Then she offers me DVDs, games, books, or toys to keep me busy. Then the operating room nurse comes to say hello.
I'm Shar. I'm the nurse that's going to be with you in the operating room today.
She will talk with my dad throughout my surgery to let him know how everything is going. The anesthesiologist stops by to talk to my dad and me. He is the doctor who will help me fall asleep.
Hi, Ling. My name is Dr. Rakuski. I'm one of the anesthesia doctors. And this is Mark. He's a nurse anesthetist. We're the anesthesia team, and we're going to keep you safe and comfy today, okay? Option number 1 is to use a mask. Through the mask, we give you some oxygen to breathe, some laughing gas that makes you feel kind of giggly and silly, and then we turn on more anesthesia medicine. It smells kind of funny, but we just have you breathe in and out through your mouth, and before you know it, you're off to sleep. Option number 2 involves placing an IV, and we give you medicine through that to drift you off to sleep. We have a special thing that we can go ahead and use to place that IV. It's called a J-tip. And what we do is we just use that to give you some numbing medicine on your skin before we place the IV. Once we're off to sleep, we're going to help you with your breathing, watch your blood pressure, oxygen levels, and your heart rate to make sure that everything goes well in the operation.
My last visitor is my doctor. She asks my dad to sign a consent form and checks me over. She also uses a special pen to mark the area on my body where I will have my surgery. Then she gives me the okay to head into surgery. Now, more friends arrive to take me and my dad down to the operating room.
And you can hang onto her hand and we're ready to go.
Okay.
I get to ride on a special bed with wheels. Colorful pictures help keep me relaxed and ready for my surgery. In the operating room, there's lots of equipment, lights, and people to help with my surgery. Now, it's time to go to sleep. Special medicine goes into my body from the mask, and it helps me fall asleep. It doesn't hurt, and my dad gets to be right there with me. When my surgery is over, my anesthesia team moves me from my bed in the operating room to the PACU. That's short for Post-Anesthesia Care Unit. It's a special place where my nurses can watch me really close as I wake up from my surgery. When I wake up, my nurse is right next to me, and my dad will be here soon. I still feel a little fuzzy because sleep medicine is still in my body. Since I'm staying overnight, my nurse brings me and my dad to my room. When I get the okay from my doctor, I get to go home. Thanks, everybody!